Duodenal ulcers. The very name evokes a sense of unease, conjuring images of gnawing pain and internal distress. These sores, etching their way into the duodenum, are more common than one might think. Often masked by subtle symptoms, they can escalate into serious health concerns. Understanding the signs is crucial for early detection and effective management. Join us as we unravel the complexities of this widespread condition. Duodenal ulcers are not merely a localized health concern, but a global phenomenon affecting millions worldwide. Statistics paint a stark picture of their prevalence, underscoring the need for heightened awareness and proactive healthcare measures. While pinpointing exact numbers proves challenging due to variations in reporting and access to healthcare, studies estimate that roughly 10% of the global population will experience a peptic ulcer in their lifetime. The impact of duodenal ulcers extends far beyond individual suffering, carrying significant socioeconomic implications. Lost productivity, healthcare expenses, and the burden on healthcare systems are just a few ripples in the pond of this global health challenge. Understanding the magnitude of the issue paves the way for increased research funding, improved diagnostic tools, and more effective treatment modalities. Furthermore, recognizing the global reach of duodenal ulcers emphasizes the need for accessible healthcare and educational resources for all. By fostering international collaboration and knowledge sharing, we can work towards a future where geographical boundaries do not hinder access to quality healthcare for those grappling with this condition. While a multitude of factors can contribute to the development of duodenal ulcers, one culprit stands out: Helicobacter pylori, a spiral-shaped bacterium that infects the stomach lining. This bacterium, often acquired during childhood, disrupts the delicate balance within the stomach, increasing the risk of ulcer formation. H. pylori weakens the protective mucus layer, exposing the underlying tissue to the corrosive effects of stomach acid. The discovery of H. pylori's role in duodenal ulcers revolutionized our understanding and treatment of this condition. Prior to this groundbreaking finding, stress and spicy foods were often mistakenly blamed as the primary culprits. While lifestyle factors can exacerbate symptoms, we now know that addressing the root cause, H. pylori infection, is paramount for effective long-term management. Unmasking H. pylori as a major player has paved the way for targeted therapies, including antibiotics designed to eradicate the infection. This paradigm shift in understanding underscores the importance of ongoing research in unraveling the complexities of duodenal ulcers and refining our diagnostic and treatment strategies. The hallmark symptom of a duodenal ulcer is a burning pain in the upper abdomen, often described as a gnawing or aching sensation. This discomfort can radiate to the back or right shoulder blade. The pain varies from mild discomfort to severe agony, disrupting daily life. If you experience persistent burning pain, consult a healthcare professional. The burning pain associated with duodenal ulcers often follows a predictable pattern, known as the rhythm of pain. This rhythm involves periods of discomfort interspersed with intervals of relief, offering valuable diagnostic clues. Imagine a metronome, its steady beat mirroring the ebb and flow of pain. Pain often surfaces hours after a meal, particularly when the stomach is empty. This hunger pain strikes 2 to 3 hours after eating, as digestive juices irritate the ulcer. The pain may even rouse individuals from sleep in the middle of the night. Conversely, some experience relief after eating, as food neutralizes stomach acid. However, this relief is often short-lived, with pain returning as the stomach empties. Noting the timing of pain episodes can provide valuable insights for healthcare professionals. Maintaining a detailed pain diary aids in diagnosis and guides treatment decisions. Burning stomach pain is the most common symptom of a duodenal ulcer, but other signs like bloating, heartburn, and nausea can also occur. These symptoms may indicate a more severe ulcer or complications. Recognizing red flags in duodenal ulcers is crucial for timely intervention. Symptoms like vomiting blood or black, tarry stools indicate serious complications. Vomiting blood may appear bright red or like coffee grounds. Black tarry stools signal internal bleeding. Severe abdominal pain can indicate a perforated ulcer. Immediate medical attention is essential. Diagnosing a duodenal ulcer is like solving a medical mystery, requiring careful detective work to uncover the culprit behind the discomfort. The journey begins with a thorough medical history, delving into the patient's narrative and symptoms. Imagine a seasoned detective meticulously documenting every detail. The patient's account of their pain provides crucial leads. Past medical history adds further pieces to the puzzle. The detective work continues with a physical examination. This hands-on approach helps pinpoint the source of discomfort. Lifestyle factors like diet, alcohol, smoking, and stress are scrutinized. By gathering a comprehensive picture, healthcare providers can formulate a diagnosis and determine the best course of action. Endoscopy, a minimally invasive procedure, revolutionizes the diagnosis and management of duodenal ulcers. A tiny camera on a flexible tube transmits real-time images. It provides a direct view of the duodenal lining. Healthcare providers can assess ulcers and obtain biopsies. Endoscopy is safe, well-tolerated, and the gold standard for diagnosis. While endoscopy offers a visual confirmation of duodenal ulcers, identifying the microscopic culprit is crucial for effective treatment. Helicobacter pylori, often implicated in ulcers, can be detected through various tests. These tests guide treatment decisions and ensure a targeted approach. Common methods include the urea breath test and stool antigen testing. Before endoscopy, the barium swallow was the primary diagnostic tool for duodenal ulcers. This technique still offers a unique perspective on the digestive landscape. Barium sulfate coats the esophagus, stomach, and duodenum, revealing abnormalities. X-rays capture the barium's journey, mapping the digestive terrain. It helps identify ulcers, strictures, and blockages. Though less common today, it remains valuable in certain cases. Innovation in medical diagnostics never sleeps, constantly seeking new methods to unravel the mysteries of the human body. One breakthrough in diagnosing H. pylori infection lies in breath analysis. The urea breath test detects H. pylori by analyzing exhaled carbon dioxide. It's non-invasive, painless, and highly accurate, guiding treatment decisions. While duodenal ulcers often announce their presence through discomfort, they can also progress silently, masked by subtle symptoms or no signs at all. Untreated ulcers can lead to serious complications, transforming a manageable condition into an emergency. Imagine a termite infestation, weakening a house's foundation, initially invisible but risking collapse over time. Similarly, duodenal lining erosion can weaken the intestinal wall, increasing the risk of bleeding or perforation. Early detection and treatment are crucial. Recognizing warning signs and seeking prompt medical attention can prevent complications. One of the most alarming complications of a duodenal ulcer is hemorrhage, a potentially life-threatening event. This internal bleeding can manifest in various ways, from subtle signs to dramatic presentations. Some individuals may experience fatigue, weakness, or shortness of breath. Others may notice black tarry stools indicating digested blood. Vomiting blood, whether bright red or resembling coffee grounds, requires immediate medical attention. This alarming symptom, often accompanied by dizziness or loss of consciousness, signals a medical emergency. Prompt treatment typically involves endoscopic therapy to visualize and control the bleeding site. Techniques include injecting medications, applying heat to cauterize, or deploying clips to seal off the ruptured vessel. Swift intervention is crucial to manage this life-threatening complication. Perforation occurs when the ulcer erodes completely through the intestinal wall, creating a hole. This breach allows digestive juices and contents to leak into the abdominal cavity. This spillage triggers a severe inflammatory response, leading to peritonitis. Peritonitis presents with sudden, excruciating abdominal pain. The abdomen becomes rigid and tender with fever, nausea, and rapid heart rate. Perforation is a surgical emergency, requiring immediate intervention. Surgery repairs the hole, cleanses the abdominal cavity, and administers antibiotics. Delaying surgery increases the risk of sepsis, a life-threatening complication. Obstruction represents another potential complication of duodenal ulcers. This blockage can arise from inflammation, swelling, and scarring caused by the ulcer. Symptoms develop gradually, starting with a feeling of fullness after meals, bloating, nausea, and vomiting. As the blockage worsens, vomiting may become more frequent and forceful. Weight loss, dehydration, and electrolyte imbalances can occur. In severe cases, obstruction can lead to malnutrition and kidney problems. Treatment depends on the severity and underlying cause. Some cases may resolve with bowel rest, intravenous fluids, and medications. More severe obstructions may require surgical intervention to widen the passageway or remove the blockage. Early detection and treatment are crucial to prevent complications. Maintaining a healthy diet and managing stress can help reduce the risk of obstruction. Treating a duodenal ulcer requires a multifaceted approach. Medications, lifestyle modifications, and sometimes surgical interventions play a role. The first line of defense involves medications to reduce stomach acid production. Proton pump inhibitors, H2 receptor blockers, and antacids provide rapid relief and promote healing. Lifestyle modifications complement medication therapy. Dietary changes, stress management, and avoiding smoking and excessive alcohol consumption contribute to a healthier gut environment. A tailored approach ensures effective treatment and prevention of recurrence. Regular follow-ups with healthcare providers are essential for monitoring progress. Adopting healthy habits supports long-term digestive health. Proton pump inhibitors, PPIs, effectively reduce stomach acid production. PPIs target the source of acid production, shutting down proton pumps. This creates a less acidic environment, allowing the ulcer to heal. PPIs are available in both oral and intravenous formulations. Oral PPIs provide convenient, long-acting acid suppression. Intravenous PPIs deliver a concentrated dose for rapid acid suppression. This route is beneficial for significant bleeding or surgical interventions. PPIs are a cornerstone in the treatment of duodenal ulcers. Proper use ensures effective symptom control and healing. Lifestyle modifications are crucial for long-term ulcer management. Dietary changes support the gut's natural rhythm. Limiting acidic foods and beverages reduces stomach acid production. Smaller, more frequent meals prevent the stomach from becoming overly full. Stress management techniques such as deep breathing exercises, meditation, or yoga can help. Stress can exacerbate ulcer symptoms by increasing acid production. Finding healthy ways to manage stress promotes healing. Avoiding smoking and excessive alcohol consumption is essential. Adopting healthy habits supports long-term digestive health. A holistic approach ensures effective ulcer management and prevention. Surgery becomes necessary when complications arise. Bleeding ulcers may require surgery to control hemorrhage. Perforated ulcers necessitate immediate intervention to repair the hole. Obstructing ulcers may require surgical intervention to widen the passageway. Surgical interventions aim to address complications and restore digestive flow. Techniques include ligating or cauterizing the bleeding vessel. Removing the portion of the stomach or duodenum containing the ulcer may be necessary. Laparoscopic or open surgery depends on the size and location of the perforation. Balloon dilation or removing obstructing tissue may be required for obstructions. Early detection and treatment are crucial to prevent complications. Regular follow-ups with healthcare providers ensure effective management. The landscape of duodenal ulcer treatment is constantly evolving. Scientists are exploring novel medications that target different aspects of ulcer development. Nanotechnology is enhancing medication delivery to the ulcer site. Gene therapy holds promise for individuals with a genetic predisposition to ulcers. Ongoing research and technological advancements are paving the way for new therapies. These advancements aim to improve patient outcomes and reduce chronic suffering. The future of duodenal ulcer treatment is bright. Innovation and a commitment to improving patient outcomes drive progress. As our understanding deepens, new therapeutic options emerge. Ulcers may become a manageable aspect of life. A future of hope is on the horizon. Preventing duodenal ulcers is empowering. Adopting a proactive approach to lifestyle choices can reduce the likelihood of ulcers. Addressing Helicobacter pylori infection is crucial. Testing for and treating H. pylori can significantly reduce recurrence. Lifestyle modifications play an important role in ulcer prevention. Healthy habits support digestive well-being. Limiting acidic foods and beverages reduces stomach acid production. Smaller, more frequent meals prevent the stomach from becoming overly full. Stress management techniques promote healing. Avoiding smoking and excessive alcohol consumption is essential. A proactive approach ensures long-term digestive health. Dietary choices impact digestive health. For individuals prone to duodenal ulcers, navigating the culinary landscape with wisdom is crucial. Limiting acidic foods and beverages is fundamental. Citrus fruits, tomatoes, coffee, and alcohol can irritate the stomach lining. Spicy foods can exacerbate symptoms and delay healing. Individual tolerance varies, so listen to your body's cues. Moderation is key for alcohol consumption. Limiting intake or abstaining may be necessary to prevent recurrence. A well-stocked pantry with soothing ingredients supports ulcer healing. Conscious dietary choices promote long-term digestive health. A balanced diet ensures effective ulcer management. Quitting smoking is crucial for digestive health. Smoking increases stomach acid production and impairs blood flow. It weakens the immune system, making it harder to fight H. pylori infection. Quitting smoking reduces the risk of ulcer formation and promotes healing. Nicotine increases stomach acid production, irritating existing ulcers. Smoking impairs blood flow, compromising tissue repair. Quitting smoking empowers the body to heal. It reduces the risk of ulcer recurrence and improves overall health. A breath of fresh air revitalizes the body from within. Prioritizing self-care is an investment in digestive health. Moderation is key for alcohol consumption. Excessive alcohol intake disrupts the delicate balance within the gut. It increases the risk of duodenal ulcers and other digestive issues. Alcohol can irritate the stomach lining and increase acid production. It interferes with the stomach's natural protective mechanisms. Limiting intake and choosing beverages with lower alcohol content can help. Spacing drinks out over time minimizes potential irritation. A balanced approach ensures effective ulcer management. Moderation prevents negative consequences. A healthy relationship with alcohol supports long-term digestive health. Stress impacts our physical health, particularly the digestive system. Managing stress is crucial for preventing ulcer recurrence. Chronic stress increases stomach acid production and slows digestion. Stress management techniques promote inner peace and healing. Mindfulness practices, such as meditation and yoga, can help. Engaging in activities that bring joy and relaxation is essential. Prioritizing self-care is an investment in overall well-being. A calm environment reduces the likelihood of ulcer flare-ups. Stress management supports long-term digestive health. A balanced approach ensures effective ulcer management. Inner peace promotes overall well-being. Duodenal ulcers, those often silent wounds within the digestive tract, are far more common than one might think, impacting millions of lives globally. As we've journeyed through the intricacies of this condition, we've gained a deeper understanding of their insidious nature, from the subtle whispers of early symptoms to the potential for serious complications if left untreated. We've unmasked the common culprit, Helicobacter pylori, a bacterium that disrupts the stomach's delicate ecosystem, increasing vulnerability to ulcer formation. We've explored the diagnostic tools at our disposal, from the endoscopic eye that provides a direct view of the damage to laboratory tests that unveil the microscopic culprits at play. Understanding the enemy within is the first step towards effective management and prevention. By recognizing the warning signs, that burning pain that often announces an ulcer's presence, the bloating and heartburn that may accompany it, we are empowered to seek timely medical attention, preventing a minor annoyance from escalating into a major health concern. Knowledge, as the saying goes, is power. Armed with a deeper understanding of duodenal ulcers, their causes, symptoms, and potential complications, we are no longer passive bystanders in our own health journey. We become informed advocates, equipped to make choices that protect our digestive well-being and minimize the risk of these troublesome sores disrupting our lives. We've explored the arsenal of treatment options available, from medications that reduce stomach acid and promote healing to lifestyle modifications that nurture the gut's natural rhythm. We've learned that a multifaceted approach, tailored to the individual's specific needs and the severity of their condition, offers the greatest chance of success. But our power extends beyond treatment. We've delved into the realm of prevention, discovering that by making conscious choices, we can significantly reduce our risk of ever experiencing the pain and discomfort of a duodenal ulcer. From embracing an ulcer-conscious diet to breaking free from the grip of smoking, from moderating alcohol consumption to mastering stress management techniques, we hold the keys to a healthier, ulcer-free future. The journey through duodenal ulcers leads us to hope and empowerment. Medical science advances, promising a bright future for ulcer treatment. Imagine a world where ulcers no longer cause suffering. Advanced therapies provide rapid relief and long-lasting solutions. Personalized medicine tailors treatment to individual needs. Researchers unlock digestive system mysteries, developing groundbreaking therapies. The most powerful tool lies within each of us. Embrace knowledge, make conscious choices, and advocate for health. Create a future free from ulcers where digestive harmony reigns.